The group is called NOAH, the National Organization for the Advancement of Haitians. We're the New York chapter, and this year we conducted a medical mission in the town of Fort Liberte, Haiti. We partnered with another organization called the Haitian American Alliance. We were able to attract 36 volunteers, of which there were physicians, nurses, planners, students, volunteers, translators, and performed at least 62 surgeries, a nephrectomy, several hysterectomies, several minor surgeries, and as well we conducted a minor HIV study.
The first day we got there, it was over 1,000 people waiting for us.
When I arrived at Haiti, it was a very different experience. Actually, I was overwhelmed because I see that there are so many patients with so many chronic and acute problems, and they don't have the money to get medications.
I remember specifically one night where we were all out of energy and we had nothing more to give, and there were more medicines that had to be handed out and a lot of people waiting around to get their medication. And although it was, I think it was almost 9 o'clock, we just, each of us individually decided that we're going to, take one more prescription from one more person and fill it. And it was really hard to walk away. I mean, I think that was the thing that's going to stay with me the most, is the fact that none of us in this group that we had, we found it really hard just to walk away.
She's very happy that she's here and she got her medication.
My name is Joyce Wilson Savage. I am a certified pharmacy technician. I've been on many missions, and they're all, chaotic, especially the pharmacy. The first stop is triage, and the last stop is pharmacy. And you expect the people to be there because that's what they want, that's what they're there for, to get their medications.
They need everything. Their equipment are so antiquated that we need updated equipment. And it is one of our goals to try and gather as much as possible for them.
As a specialist, I'm a gastroenterologist. I thought they had some a unit there for gastroenterology, but when I went there, they didn't really have one. They have some scope, they have some machine, but they are kind of old-fashioned.
Here, if you could do a highlightation of this.
We did a lot of minor and major surgery, not with what we are used to in the United States, but we did the best with what was available to us.
So this is the operating room. As you can see, it's pretty basic. They just have kind of standing lamps that they put in as opposed to true surgical lamps that come down from the ceiling. This is the operating table, a basic operating table. This is the anesthesia machine, the anesthesia area. Here you see just a couple of sponges and some gloves and maybe like 6 different kinds of suture. They don't have a blood bank here. They don't have any means to transfuse somebody. You don't want to operate on anybody who has any kind of medical problems that would be an anesthesia risk. Well, there's no way to save their lives. There's no intensive care units. I mean, this is it.
The crowds outside are at least 200 people for surgery. In the best of cases, we couldn't do that in a week or 10 days. If we can do 20 patients a day, we're moving along well. But even at 30 cases a day, there's no way we can finish everybody who's outside.
want to see the words. I'm going to slow the heart rate down a little bit because the one I listen is beating kind of fast too. And give us some omeprazole for her stomach.
Okay.
Firma? Yeah. Firma has a little gastritis.
Looks like there's a foreign body hanging in her eye, and her pupils are fixed and dilated, and her lens is intact. It's not pierced anywhere, and you can see it move around.
We are interested, especially in the water purification system, because we saw so many children with waterborne diseases, and it would be so helpful to them as a whole, because the town basically they have built some wells, but even these wells, the water there is not necessarily clean.
My name is Davika Bridgewell. I'm a nurse practitioner in pediatrics, seeing many patients with varying complaints, but their primary complaint was respiratory issues, abdominal issues, parasites is a major one as well, and skin disorders.
My name's Steve Cattle. I'm a pediatrician. I saw lots of children, about 100 kids between myself and a nurse practitioner each day that we saw patients. We did a lot of good work, and did some work for kids that people seem to neglect here or didn't feel like work they should have been doing. And I got a lot of good praise from some of the parents that I saw. Breathe in and out.
One of our nurses from Calgary, Canada, Michelle Taggart, and Dr. Paul Alexis from New York held health education classes, and they taught hygiene and first aid. And one of our focus, again, going forward is to continue on with these classes.
About 25 youths aged 20 to 25 were chosen from different areas of the community, be available within those quadrants of the community to be able to be designated first aiders, be able to learn cuts and burns, major bleeding, taught them choking, prevention.
My name is Paul Alexis. I'm a physician. I'm working basically as a health educator in New York. I'm Haitian American, and I was very proud to go back to my country after 10 years.
There are so many different nationalities willing to contribute to the cause. However, one of the needs is lots of translators, so what I've been doing mostly is, as a speaker of both Creole and English, I've been translating for some of the doctors who only speak English.
Okay, merci. This is Madame Joseph Canez. She's been suffering with the freeborn for over 6 years. This is one more person who's been very happy to have a free surgery and free medication.
I was so grateful to come on this mission. I feel that I got a lot accomplished. A lot of young children were seen, the elderly were seen, and they seemed grateful for our services. So it was nice to come back home and serve the Haitian people.
We saw people from all across Haiti who were able to touch a lot of lives.
And the mission was successful. It was wonderful. Without help, we cannot get it done, and we need more volunteers. We need more doctors to come out. Haiti is in dire need of health care.
We saw what this town could be and automatically fell in love with the place.